bring 'em out, bring 'em out, bring 'em out, bring 'em out. It's hard to yell when the barrel's in your mouth. Come on. Bring 'em out, bring 'em out. Hey. Bring 'em out, bring 'em out. Yeah. Bring 'em out, bring 'em out. Hey. Bring 'em out, bring 'em out.
VIP, coming live from the VIP. Heard the nightlife, lost life without me. Most feds in the state wanna see by me. The whole city got pissed, heard he got 3. That other rapper got a hit, but shout it.
Hi, I'm your nurse, Sorelli. Nice to meet you.
What's up?
Well, I'm just here to listen to your heart. Is that okay?
Oh, yeah, that's fine. I'm like the poster child for good heart sounds. I run them Ironmans, climb mountains, swim across oceans, work out like 5 times a day.
Wow.
Not to brag or anything.
Wow, you're really in shape, so you should have a good heart sound. I'm just going to listen at Herb's Point.
Oh, I think I've climbed that mountain before, you know?
Well, your Herb's Point is located in the middle of your chest, in your 3rd intercostal, next to your sternum.
Oh, I knew that.
Okay, I'm just going to take a listen. Wow, you have a great heart sound.
I know.
You have a normal S1 and S2 that sounds like lub-dub. S1 is your lub, and it's the first heart sound. It's caused by the turbulence due to the closure of your atrioventricular valve at the start of systole. The second heart sound, or the dub, or S2, is caused by the closure of the aortic and pulmonic valves, marking the end of systole.
Hi, Miss Abel. How are you doing today?
I'm good. How about you?
I'm doing great. My name's Nurse Megan. I'm just going to listen to your heart sounds a little bit. Is that okay? Mm-hmm. All right. All right. Well, it sounds like you have an extra heart sound called a split S1.
I have a split what? Oh, am I gonna die? Oh.
A normal S1 is when the AV valves close and you start systole, which is when the ventricles of the heart contract and pump out blood. In your heart, the 2 AV valves close at slightly different times, and you get that extra heart sound because of that.
Oh. Why hasn't anybody told me about this before?
With some people, this is quite normal, but hard to hear it during most times. It's easier to hear when you're pregnant because you have higher blood volume and workload over the heart.
Sure do. That won't make the baby come out sooner, will it?
No, no worries about that.
Oh, too bad. Well, thank you.
You're welcome. Hi, Miss Benetti.
Hi.
I'm Nurse Megan. How are you doing today?
I'm good. How are you?
I'm doing great. I'm just going to take a listen to your heart. Is that okay?
Yeah.
All right. Well, it sounds like you have a heart murmur.
What does that mean? Is it okay?
Let me explain. A murmur is sound that's made when your heart and your greater blood vessels. It's from turbulent flow, and it can either be pathologic or an innocent murmur.
Okay. What does that mean?
Well, murmurs that are innocent can occur in children and adolescents, and it means that there's no valvular or pathological cause.
Okay.
Murmurs may also be due to congenital or acquired valvular heart defects.
Okay.
Diastolic murmur always indicates heart disease and what happens when the heart is filling with blood. You do not have this kind of murmur.
Okay. So what kind of murmur do I have?
The other type of murmur is systolic, and this can happen with or without heart disease. It happens when the ventricles of the heart are contracting and squeezing out blood.
Okay.
We are going to perform an ECG and echocardiogram on you to determine what kind of murmur that you have.
Okay.
Hi Kelsey, my name's Brittany and I'm going to be your nurse today. I'm just going to start off by doing a cardiac exam on you.
Okay.
Okay, so I'm just going to be taking a listen to your heart here. I'm just going to place the stethoscope right under your gown and listen for a couple seconds.
Okay.
And Kentucky, 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 Kentucky.
I noticed you have an abnormal heart sound. It's called S3. It's common in children and young adults, but I noted from your chart that you're 43. So I need to ask you, are you pregnant, or is there any chance that you might be pregnant?
Oh, no. We don't do that anymore. Why do you ask?
Oh, well, in pregnancy, S3 can be normal, but if you're not pregnant or not a young adult or child, then it can be a sign of heart failure.
Okay, well, what do I need to do now?
Well, I think I'm going to refer you to a cardiologist so he can take a closer look and figure out what's going on with you, since you're not a young adult or a child and you're not pregnant.
Okay. That's it. Oh, dear.
I'm Nurse Sorelli. I see you're a new patient.
I am. I just moved up here from Tennessee.
Wow. Do you have any current diagnosis we should know about?
Well, I was told I have an aortic stenosis, but I don't think that's very important. I never heard of it.
That's actually a pretty important diagnosis. It means that your aortic valve is narrower than usual. This can cause ventricular hypertrophy or stiff wall. If you have a stiff wall, it means your aorta is working harder to pump the blood through the valve. You may also have an extra heart sound called S4. Do you mind if I list it?
Go right ahead, dear.
Tulubda, Tennessee, 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 Tennessee.
Well, you actually do have an S4.
S. What are you talking about? S3, 4.
Well, basically your heart's supposed to sound like love dub, but it sounds more like tulub dub.
What are you talking about, lady?
Well, you see, when I put this round thing on your heart, I can hear Tennessee. Does
Are
that
you making fun of me for my lack of education? I suppose you're going to tell me my stomach says Ohio and my lungs say R2D2. What are you talking about?
No, that's, maybe we should just skip the heart for now.
S1 and S2 are normal heart sounds that sound like lub-dub, lub-dub. S1 is best heard over the apex and S2 over the base of the heart. A split S1 is uncommon but still considered normal and heard over the tricuspid area. It sounds like T-lub-dub, T-lub-dub. S3, S4, and murmurs are abnormal heart sounds best heard over the apex in the left lateral position. S3 sounds like Kentucky, Kentucky, and S4 sounds like Tennessee, Tennessee. A murmur is a soft blowing or swishing sound from turbulent blood flow.